So good morning, everyone. Thank you so much for joining us this morning. My name is Brooke Oliveri. I am the manager of the Long Island Health Collaborative. For those of you who may not know, the Collaborative is a group of 300 plus local county health departments, hospitals, and community-based organizations, all working toward improving the health of Long Islanders. So today we are presenting Talk with a Doc, Alzheimer's disease and dementia. Some housekeeping before we get started. Today's program is being recorded. We will have some pre and post-event poll questions for you to answer today. And we will have time for a robust Q&A session at the end of the presentation. So please feel free to put your questions in the chat and hold those questions until the end of the program. Many thanks to AARP, our sponsor. We are so excited to have them on board with this program. And now I would like to introduce Elaine Goldsmith, an AARP volunteer. Oh, Elaine, you are muted.
I was listening before. Hello, my name is Elaine Goldsmith, an AARP Long Island volunteer. On behalf of AARP, welcome to today's Healthy Talk with a Doc webinar. We are committed to helping you stay healthy and stay connected, so we congratulate you for taking the time to learn more with AARP and the Long Island Health Collaborative. AARP is a nonprofit, nonpartisan membership organization for people age 50 and older. There are 38 million members nationally, approximately 2.5 million in New York State, and about 500,000 living on Long Island. AARP works to strengthen age-friendly communities and make for happier, healthier residents of all ages. And we advocate for what matters most to people 50 and over and their families, with a focus on health security, financial stability, and personal fulfillment. Learn more about other online classes, events, local discounts, volunteer opportunities, and more at aarp.org near you. Thank you.
Thank you so much, Elaine. Now, before we get started and before I introduce our featured speaker today, we do have some poll questions for you to answer. I'm going to go ahead and launch those now. If you wouldn't mind, please taking a moment just to answer these questions. We would love to get your feedback. They are pretty brief. There are about 6 of them. It should just take a minute or two. And I do apologize for any barking you may hear in the background. I see some answers coming in. Thank you, everyone, for taking the time. We really appreciate it. I still see some answers coming in, so I'm just going to give it a few more seconds and then we will move on here. Okay. Well, thank you all for your feedback. That is so appreciated. And now, hold on for just one moment here. And now I would like to introduce Dr. Christodoulou. Dr. Christodoulou is from the Stony Brook Center of Excellence for Alzheimer's Disease. He is a licensed neuropsychologist, received his BA in psychology and his MA in community clinical psychology from the University of Maryland. He earned his PhD in psychology, specializing in neurocognition from the City University of New York. As you can see, he has a pretty impressive resume. He is a wonderful partner of ours. He is always willing to participate in community events like this one, and we are so excited to have him today. So welcome, Dr. Christodoulou.
Thanks very much, Brooke. It's my pleasure to be here. Should I share my screen?
I have your talking points right here for you.
Oh, you have it right there. Great, wonderful. Okay. So thanks very much for inviting me. It's a pleasure to be here, as always. Give me just 1 second. I'm going to go full screen here. Okay. Yeah, so today what I'd like to talk to you about is Alzheimer's disease and dementia. And I'd like to talk just briefly and then allow lots of time for questions. So I'd like to start by just discussing what dementia and mild cognitive impairment, which you might not be familiar with at all. Dementia is not a specific disease of the brain. Dementia it's like a fever. Okay, so you can have a fever that's caused by a variety of different causes. And likewise, you can have dementia for a variety of reasons, different things that are going on within the brain. So dementia just refers to a category that we place people in when they're having difficulty thinking or remembering or speaking or seeing things in space. So there's a problem with cognition, and it is severe enough that it's impacting the person's ability to make their way out in the world, to deal with activities of daily living, things like driving or taking medications independently, managing your finances. Now, there are some folks who might have some problems with memory or attention or some other area of cognition, but are still able to manage their daily lives. And those folks are in a category we define as mild cognitive impairment. And so those are the things that I'm going to talk about today. Now, dementia is a huge health concern, as we all know. It affects more than 50 million people throughout the world. And here in the United States, it's over 6 million. And even here on Long Island, it's over 50 million people. And we spend a tremendous amount of money trying to help those who have this disorder and provide lots of free help. If you have a friend or a spouse or a loved one that has a dementia, we know that there's lots of time and effort that's put towards helping those folks. The likelihood of someone experiencing a dementia changes as we get older. So it tends to affect people who are 65 years old and older, although it can affect people who are younger. When it comes to Alzheimer's disease, which is a specific disease of the brain, it tends to be more commonly found in women than in men. And there are also differences between different ethnicities. So the likelihood of a dementia is higher in those who are Hispanic and African American. But it is, it is also a risk for all of us. Now, there are a variety of reasons that someone might experience a cognitive decline. Some of them are due to different sorts of diseases like Alzheimer's, which I'll mention which I'll describe to you in a little more detail in a moment. There are other diseases like Lewy body dementia. There are vascular dementias. Vascular dementia is caused when the blood supply to the brain is affected through a stroke or perhaps a series of small strokes that are not noticed clinically until they sort of build up over time. There are a variety of different reasons that someone could experience cognitive decline. Some other things are reversible, things like vitamin deficiencies, sometimes chronic infections, sometimes dehydration. There are a variety of reasons. There are also medicines that people take for other reasons that can have an impact on a person's ability to remember and to pay attention. And so all of these things are are possibilities, and that's why it's important when the first signs of problems occur for you to see your healthcare provider and have a checkup. We also know that people who do have any one of these diseases can benefit from early detection. People who are identified and diagnosed early tend to have a better quality of life. Their families do better as well. They're more likely to be able to stay at home, and they do better in terms of their quality of life. So what I want to distinguish, in case it's not clear to you, between Alzheimer's disease and dementia. So dementia, as I mentioned, is just this decline in cognitive abilities that becomes severe enough that it impacts a person's ability to act in their daily lives. But Alzheimer's disease is a specific disease. It's the most common disease. It's the cause of the brain damage that leads to the dementia. Now, we don't know what causes Alzheimer's disease to begin, but we think that it is linked to abnormal proteins that are identifiable in the brain. There is an abnormal protein called beta amyloid that builds up within the brain between the nerve cells, between the neurons, and it damages the communication between those cells. It damages the cells and kills the cells themselves, and it causes an inflammatory response as well. Tau is another abnormal protein that is found in the brains of folks who have Alzheimer's disease. And it occurs inside the cells themselves, also killing those cells, leading to an inflammatory response. And so it's those abnormal proteins that are thought to be the major culprits in what is causing Alzheimer's disease. Many folks are concerned because we often know people who have Alzheimer's disease, and it may be in our family, and so we're often worried about these sorts of things. But I can tell you a couple things about that. There are different forms of Alzheimer's disease. It generally affects people who are older, who are over 75 years of age. But there are some forms of Alzheimer's disease that tend to affect people who are younger. And it's that early onset form of Alzheimer's that tends to hit people before 65 and perhaps even before 60 years of age. That form of Alzheimer's tends to be more strongly genetically linked. We know that there are some particular genetic factors and that impact amyloid. I mentioned that abnormal amyloid buildup in the brain. There are certain genes that lead to abnormal amyloid buildup. And if you were to have one of those genes, you would be very likely to develop this early onset form of Alzheimer's. But the vast majority of people who have the disease tend to develop it later on in life. And while there are some genes that appear to be linked to it, they are by no means as strongly linked as that early onset form. So there is some increased risk if someone in your family might have it, but it is by no means a sure thing. And there are things that we can do, that we can all do, to try to stay healthy. And I want to talk about some of that as well. As we get older, it is common to experience some changes in cognition, right? And sometimes those things are mistaken. Sometimes people worry that those changes are an indication that we might be experiencing Alzheimer's disease or some other form of dementia. And so I want to talk a little bit about some of the cognitive changes that take place normally, and distinguish those from what happens in Alzheimer's disease and other forms of dementia. So our brains are designed to try to help us understand what's important out there in the world, and then help us to deal with those things, to find the food that we want, the mate that we're interested in, to avoid the dangers that are out there, to find shelter. And when we are young, as infants, all of this is new to us, right? We don't have very much information to go on, right? And so everything is kind of new and novel to us, maybe a little bit scary sometimes. But over time, we develop knowledge, wisdom, hopefully, about those things, about those situations with which we're familiar. And we develop routines and habits, ways that have worked for us, or have at least worked well enough to keep us alive so far. And so a lot of the things that we do as we get older become habitual. And so about 40% of our daily lives is sort of by habit. So driving a car, it might have been very difficult to do that when we were younger, when we were first learning how to drive, but now we do it without thinking. We might arrive at work or arrive at our destination without really realizing sort of all the steps that we took to get there and all the turns that we made on the road to get there, because it's sort of automatic. So a lot of things that we do are sort of automatic. And they become sort of hardwired. Those things tend to stay with us. They are harder to disrupt even as we get older. But the new learning so if I were to give you a list of words to try to remember, if you were 20 years old, your ability to learn that list of information and then hold on to that over a period of 10 or 15 minutes would be better than if you were than the average person who's 80 years old, right? So there are some differences in the ability to learn new information and process it quickly and efficiently, and to hold on to it over a period of time. That is a normal change that does occur as we get older. And so, those are the sorts of things that we might expect to occur with normal aging, okay? Some of the things that we don't expect to change as much are things like our ability to know where we are and know essentially what time it is. And so, our sense of time and place and person tend to stay with us. We might forget the exact date of the month, and we might even be confused about the day of the week on occasion. That's normal, but our ability to know whether it is summer or winter over that longer period of time, that tends to stay with us. And so if someone is not knowing, whether it's summer or winter outside, not knowing what the month of the year is, that tends to be a more serious matter, and something that you ought to speak with your healthcare provider about. There are other things, such as repeating oneself. People have different personalities, right? Some people like to share stories over and over again. But when people begin to share those stories more frequently, and it seems as though they don't realize that they've shared that story recently, that can sometimes be a sign of something more than normal aging. There are a number of things that we can do to try to lower our risks of developing a dementia like Alzheimer's or some other form of dementia. And while we do not have cures, unfortunately, for Alzheimer's as of yet, there's lots of research going on. There are some new medicines that have come online. There are medicines that can treat some of those symptoms. But there are also a number of things that can lower all of our risks to developing a dementia in the first place. The thing to keep in mind about our brain is just 3 pounds. It's very little in terms of our total body weight. But our brain uses about 20 to 25% of all the nutrients that we take in from the environment, or the oxygen and the glucose that are the fuel for our bodies. About 20 to 25% of that goes to the brain itself. And so we need to keep those pipes clean. Those nutrients come into the brain through the bloodstream. And so it's very important to do what you can to keep your heart healthy, because your heart is supplying those nutrients to your brain. And so whatever's good for your heart is also good for your brain. So many of the things that we can do to keep our brains healthy is what is the same as what keeps our body healthy in the first place. So among the most important things that we can do is to be active, physically active on a daily basis. So we know that, and there have been many studies that have looked at exercise, especially aerobic exercise. Aerobic exercise is any exercise where your heart rate is increasing a little bit. Maybe your breathing is a little heavier than it might be otherwise. Aerobic exercise like that, things like walking or dancing or gardening or doing household chores, doing the laundry, going up and down the stairs to do your laundry. Anything other than probably what you're doing now or what I'm doing now, which is sitting, can count to a degree as aerobic exercise. And getting that aerobic exercise has been found not only to help our general health, but to help our brains. People who do aerobic exercise tend to be thinking better, remembering better, to be more flexible in their ability to solve problems than people who don't. The other one other very important way that we can keep ourselves healthy is through our diet. A Mediterranean diet. You might have noticed my last name is Christodoulou. So I grew up with this Mediterranean diet, whether I liked it or not, actually. The Mediterranean diet includes a lot of vegetables, a lot of fruits, the use of things like olive oil and healthy fats like that, lots of nuts, whole grains, not as much red meat, and not as much sweets. So in my family, that was the problem, right? There's just a little more meats and sweets than maybe we should have had. But the Mediterranean diet allows you to have those things as well, but on a more limited basis. So the regular American plate, is sort of steak and a big steak and maybe some potatoes and maybe some green beans on the side. Here, what you want to do is give a little more room for those vegetables and fruits, and a little less room for the meat on your plate there. I think I'm going to stop there, if that's okay, Brooke, because I want to leave lots of time for folks to ask questions. I'm happy to do that.
Yes, this was wonderful.
Sure.
Before we get to our Q&A, we do just have some tips and laws for walking safely. As Dr. Christodoulou mentioned, walking is a great way to stay active. So some of these are New York State laws. Always use the sidewalk. If there is no sidewalk, always walk facing traffic. See and be seen, wear brightly colored clothing, carry a flashlight when you're walking at night, make eye contact with drivers whenever possible. Cross streets at corners or in crosswalks, that's also a law. And don't text or talk on your cell phone while you're walking. It can be just as dangerous as, driving using a cell phone. And for more information on topics and laws like this, you can visit walksafeli.org. Now, we would love to open the floor to questions. Please feel free to unmute yourselves or raise your hand or put your question in the chat and we'll get that answered for you.
I have a question.
Sure.
You said, the doctor said that there's a way to identify if your brain is not getting the regular proteins it should have. Should that be one of the things when you go to get evaluated that they should do, is a brain scan?
Not necessarily. So there are some, there are a number of other steps that you would probably take before then. And the typical brain scans are not looking for these specific proteins. It wasn't that long ago that we couldn't see these abnormal proteins at all until a person passed away and they did an autopsy of the brain and they could identify these changes that had taken place. There are some newer technologies that allow us to do brain imaging to look at some of these abnormal proteins, but they're not typically used on a regular basis, right? So it's certainly not the first step. There are times when we're trying to distinguish between whether someone might have Alzheimer's disease or some other form of dementia. And so in some cases, a doctor will order that type of a scan, but it's not, it's certainly not the first thing that you would be asking for or need to do.
Okay, thank you.
You're welcome.
We have a question in the chat. What type of test can one take to identify the presence of the gene related to early onset Alzheimer's?
There are your doctor would know the specific forms of amyloid abnormalities for these genes. I'm trying to think of the specific one of the specific genes. Your doctor will know if they're. It's fairly rare, right? So, but if someone is experiencing these early onset symptoms, there are blood tests for these abnormal amyloid genes that can be done.
Okay, we have another question in the chat. Is it normal to forget people's names or simple words at age 55? I'm 63 and have been experiencing this, feeling like it's getting worse. Are these early signs of dementia or Alzheimer's?
Right. Yeah. So it's hard to say offhand, but the symptoms of having some difficulty with naming or having some difficulty coming up with a word are not, they are so common as we get older that it's not diagnostic. We all sort of start off at different levels though. So some people are kind of, more proficient in their language than other folks. And so, there isn't any pat answer, but there are some tests that can be done to look at whether a person of your background, and education and so forth is having more problems than we would expect at that age. And so we've given these tests to many people at different ages who have different levels of educational background and so forth. And so we can use those tests to try to get a sense of whether what you're experiencing is out of the norm. That doesn't necessarily mean that the person has a disease that's causing this, but it could be a signal to get more help from your healthcare provider.
Thank you so much. There are a few more questions in the chat. Are there any supplements that claim to help or prevent Alzheimer's or dementia?
Yeah, there are lots of supplements that claim to help, but the question is whether they actually do. And so far the evidence isn't there to promote these supplements. But if you watch television, you see that lots of advertisements for them. But when people ask me, they may not hurt you, but we don't know that they help you, and they're not cheap, and so I would think that it's better to just take a walk than to take one of these pills. And the walking is free.
True. Yes. Okay, there are two more questions here. So every once in a while, I'll be driving and nothing looks familiar on highways I drive frequently, always at night. Is this a visual issue or could it be aging?
Well, there are some changes that take place with our vision, and it can become harder for us to see at night. So that's a question of safety as well, whether the person is experiencing dementia or not, or experiencing some sort of cognitive decline. Having some difficulty knowing where you are when you're driving to familiar places, that can sometimes be an indication there might be something there. I think that's the sort of thing that would be good to follow up with your doctor. But it doesn't necessarily, it could, it happens to everybody. It's sort of a matter of how often it's happening, whether it's happening more than before, and so forth.
Okay, great. And the last question we have in the chat right now, could you please talk about the impact of COVID and dementia? Could COVID impact brain health, lead to any form of dementia or memory changes?
So we're still learning about COVID, right? Because it's such a new phenomenon. We do know, so I mentioned early on that as we get older, a lot of our behavior is habit, right? The things that we do without thinking. And so the one thing that COVID taught us was that, it threw us out of that routine, right? And so much of what we did and how we were acting in our daily lives changed with COVID, right? And so that is stressful to everyone, but as we get a little older, we're a little less flexible in responding to those new changes. So that alone was a bad, a bad outcome caused by COVID. But that doesn't necessarily mean that it was affecting our brain in order to cause that change. That is, it may not have been brain damage caused by COVID that led to that kind of a problem. But there are studies that are looking to see whether COVID is causing some form of brain damage. So sometimes it can cause changes in blood supply to the brain. And we know that does occur on occasion. And we're also looking to see whether COVID affects inflammation. Chronic inflammation is a problem in many diseases, but also in a number of brain diseases like Alzheimer's disease, like Lewy body dementia. And so we want to understand whether COVID is another factor that may be leading to this inflammation, which would be bad. So there are a number of studies going on. Actually, we're doing work at Stony Brook on these things as well. And so you're welcome. I don't know if you have my contact information on one of those slides, but you're welcome to call us at the Center of Excellence for Alzheimer's Disease at Stony Brook. we could talk to you about that.
Okay, wonderful. So we do have some parting questions for our audience here. We do just have some final polls. I'm going to launch them now. If you do have any further questions, please feel free to put those in the chat. These are just some follow-ups to gauge your sentiment about the program, what you feel you learned, and your thoughts and feelings after. While you are answering those questions, we do have one more in the chat. What kind of medicines are in the works? And how soon do you anticipate they may be available?
There are a number of medicines that are sort of in that pipeline. A number of them look at trying to reduce amyloid in the brain. One of those medicines came online recently, but right now the only way to get that medicine, Aduhelm, is to take part in a clinical trial. The government is trying to help understand whether the reduction in the amyloid, that abnormal amyloid protein, also helps the person's cognition, their ability to think and remember. And so if you're willing to be in a clinical trial to look at that, then you can get access to that medicine at some places at least. There are a number of other medicines that work similarly that are under FDA review right now.
Very interesting. All right, I'll just give it another moment for these poll questions here. Thank you to everyone who is sharing your thoughts and opinions with us. We so appreciate that. Okay, I'm going to close the poll now. Thank you again. And we do just want to remind you that we have some other upcoming events. Alzheimer's disease and dementia was today, of course. We also have heart disease and high blood pressure coming up on June 15th, arthritis and osteoporosis coming up on June 29th, and Breathe, all about asthma, bronchitis, and COPD on Wednesday, July 13th. And we also have 2 culminating walking events. As the doctor mentioned, walking is a great way to keep yourself healthy. And we will have one at Belmont Lake State Park on August 6th and one at Jones Beach on August 13th. So thank you so much to all of our attendees. Thank you to Dr. Christodoulou. You are always so interesting to hear speak. I've had the privilege of listening to you present a few times, and it's always very enlightening. So many thanks to you and to AARP.
Thank you very much, Brooke. I appreciate the opportunity.
All right. Thank you all. Have a wonderful afternoon.
Bye-bye.
Bye-bye.